Going girls in Narok are pregnant. According to the County Education Department, 248 of them will be sitting their national exams this year. Well, this sparked debate online, with some Kenyans asking whether it was as a result of early marriage, bad parenting, or teens behaving badly. Whatever the reason, teen pregnancy in this country is no longer an issue to ignore. Back in July this year, the Ministry of Health revealed that Kenya ranks third worldwide in teenage pregnancies. When we looked deeper into the numbers, 1 in 5 adolescents aged between 15 and 19 years are already mothers or pregnant with their first child. Now, when you widen the age bracket to as young as 10 years of age, 1 out of every 3 mothers attending an antenatal clinic is an adolescent aged between 10 and 19. Now, as far as which counties are hardest hit, they are Nairobi, Kajiado, Homa Bay, Meru, Kericho, Narok, Kisii, Mandera, and Bomet. And they hold 56% of all teenage pregnancies. And this was last year. Now, the statistics get even more shocking. This year alone, the Ministry of Health reported 45,724 pregnancies among girls aged between 10 and 19 in January and February this year, averaging about 775 pregnancies a day. So, how did we get here? Well, joining me now to unpack all this is Esther Wamboi Kimani, a gender and sexual and reproductive health and rights expert and trained psychologist, as well as Waithera Wanjiru, a community organizer and mobilizer who works with young mothers in Kayole. Ladies, thank you so much for joining me. Let me begin with you, Esther. Joining us from Bangkok, Thailand. I know it's the wee hours of the morning for you, but really quickly, how did we get here? Very simple question.
How did we get here? Very good question to ask, Rubadere. Can you hear me?
Yes, you're audible. Go ahead.
Okay, great. I think we got here because we really ignored, as a society, we ignored the fact that young people are growing up so fast, and we are not there to really handhold them in terms of giving them information for them to make informed sexual choices. So when you look at Kenya at the moment, you find that in schools where children spend 75% of their time, the sexuality education that they get is, bare minimum. They just get, adolescents, when you get to 15, 16, you start having breasts. So like really light, information around sexuality. When you get at home, you find that, we don't talk about sex. We've grown up really fearing talking about sex and sexuality. Even our parents, I remember growing up, nobody told me about sex. And it's the same thing that we are doing currently. When you go to churches as well, churches, we are all, told, religious, to be able to really abstain from sex till we get married. But then it's 21st century, there's internet, and you find that the responsibility of informing these young people around sex and sexuality, nobody has that, nobody's taking that responsibility. It's not the church, it's not, the government in schools, it's not parents. So you find that because of the fact that each and every single person, who is supposed to be guiding these young people and getting that responsibility, that's where we find that teenagers are left to be able to find this information on their own. So where are they getting it? They're getting it from the internet, they're getting it from from their friends. And most of the time, it's really not informed information when it comes to sexuality. So one last thing I will also like to say is the fact that even when, there is that information that, these young people can access, we still simmer it. We simmer it to, and I'll give an example. So the government of Kenya has an adolescent's guide, very amazing document. But when you read through it, one of the things that is there, it's written, causes of teenage pregnancy is sexual activities. So you find that we're already simmering the information to these 10 years and 19 years, and they're already having sex. And then the fact that even we are, each and every day, we keep on opposing the introduction of sexuality, comprehensive sexuality education in schools. Parents don't want to talk about it. So then, there's nobody who is giving them this information that they need. And because of that, then, they are engaging in consensual sex with each other without information, and then they get pregnant. And then after they get pregnant, that's when you're like, oh yeah, they need to go to antenatal care, make sure they have the 4 visits. So where are we when we are supposed to prevent these pregnancies to get to where we are? So I think what has gotten us here, it's because we have all refused to be honest and have honest conversation around sex, sexuality, growing up, healthy relationships, because we feel like having this honest relationship is what is going to make young people have sex, but they're already having sex. So I think we need to really rethink about how we address the whole aspect around teenage pregnancy, because it's all about information, as comprehensive sexuality education for them to make informed sexual choices.
Okay,
Thank
Esther, let me bring you in, Esther, on that, Waithera, because Esther has just talked about failure on 3 fronts: school, home, religious groups, right? So when we're looking at what needs to be done moving forward, if it's a matter of too little, too late, as far as interventions go, what in your view needs to be done? What will be effective?
Okay, if I hear you clearly, if I can hear you clearly, Victoria, what needs to be done? I picked it up from where Esther has left it, where she talks about the need to break down information and speak in a language that our young adolescents can understand. Further, bring ourselves to that level of honesty as a nation and as a country, that however much we try and bury our head in the sand, there's a lot of peer-to-peer relationships that are happening. And the effect starts with responsibility as soon as a child has given birth, or as soon as a young man has become a father to a young child. So since I think at some point we have been concentrating much as stakeholders or players within this community organizing field to talk about sexuality and pivot it around the girl child, I think it's important to also now have this comprehensive sexuality education to bring in the young man, the young teenager, and have a discussion that is as honest, and bring in different players and stakeholders in our communities, and also at a national level. For instance, the National Gender and Equality Commission to devise policy intervention mechanism to perhaps consider the numbers of how many teenage parents we have and how we can have them managed in ways that we could include them into social protection. And if not so, then involve ministry like the Ministry of Education to incorporate this kind of studies like SRHR, that is sexual reproductive health rights studies in school, or for the younger age, now talk about comprehensive sexuality education. The other one is on introduction to, leave alone now the basics on comprehensive sexuality education. The other one is to empower and enable community organizers, community health volunteers, and all these key persons in our organic movement as community organizers to reach out and partner with institutions, not necessarily make it harder for them to be institutions and teach these young children in the primary point of intervention, which should be school, on how to identify unhealthy sexual relations, on how to speak abstinence, and also the options that are available once a teenager is sexually active. So, yeah.
You know, and Esther, let me bring you in there, because what Waithera has just described is the huge social protection burden that will come as a result of these teen parents coming up. So when you talk about the support or resources that are available for a teen mother. She gets pregnant. Can she go back to school? Does she get skills where she's able to earn a living? You know, what exists now to offer that support to a teen mom once she's in that situation?
Okay, I must say that also we are lagging behind. There are no really programs out there that really support this teenage mother, you know, and so the programs that we have are really instituted within, for example, the health centers, where if a teen mother comes, so the whole education is around, okay, safe delivery, that's bit. You find that at the community level as well, you know, already she's ashamed in the family. You know, there's a lot of stigma around teenage pregnancy. So nobody is really talking to this, you know, teenager in terms of how do you navigate the situation that you're in. First, we already failed them when they got pregnant, and we know that some of them are having consensual sex with each other. But also there are those cases that, you know, they're being raped, they're being defiled. So at that moment, we didn't even, you know, have the conversation around what options does this girl have. But then now we get to a point where it's 9 months. You know, we also, the programs are really into antenatal care, 4 visits, self-delivery. Then this child goes back to the family. And it depends on where, you know, where you're coming from. So then the burden goes back to the mother and the parents, and the society as a whole, to ensure that then the small child that is already here is being taken care of. So there's no programs that really focus on, you know, holistic way of really handling, you know, teenage mothers. And for example, some of the efforts that we have seen is for civil society, like some of us that, you know, convene safe spaces to be able to talk to, you know, young mothers and teenagers to know what is it that, you know, you need at that time. Is it, you know, going back to school? How can we support you to go back to school? Is it, you know, information around, you know, sexual reproductive health and rights in terms of contraceptives? Where can you get them at that time? Is it about, you know, a skill that you want to get? For example, you're 20 years, you're already having 3 children, you're already forced into this union, you know, then, you know, how do we support you in that way? So having safe spaces to have these conversations honestly and support teenagers where they are. But when it comes to the government, because then this burden should also be taken by the relevant ministries within the government. Interministerial joint action, you know, Ministry of Health, Ministry of Education, National Gender and Equality Commission, Ministry of Gender, to say what type of support systems and structures can we ensure that these girls have. For those that have gone through sexual abuse and sexual violence, you know, is it about safe spaces? You know, what are the mechanisms when it comes to mental health that supports them through that? Also, just to mention that even as we are thinking about the solutions, you know, the solutions should be holistic in terms of also centering, of course, the girl, but at the same time, the boy, so that then it's more all of them being able to really get supported. So right. The programs are not there. And those that are there, and I'm sorry to say this, there are those that are, you know, they're not real in terms of supporting the child, the girl, from getting pregnant to pregnancy to delivering to going back to school. Yeah. They are really like, you know, piecemeal in that. So then it's time for us to really think about real solution to all these 700, I had you mention 775 pregnancy per day. Those are 775 girls each and every day. You know, how will we ensure that we all support them so that then, you know, their life is not over? Because, you know, truth be told, being pregnant and you're 15 years and you're coming from a humble background, how will you go back to school?
Yeah, it certainly is a disruption.
How will your dreams be achieved? But then when you put these solutions there, these mechanisms, then we can be able to support them. But right now, we don't have. And, you know, it's just shame on us that we don't have these mechanisms, but we also don't want them to get information for them to make informed sexual choices.
Absolutely. Very quickly, because we've run out of time, Waithera, If you can quickly speak to the issue of male engagement, who's talking to the boys? Because a lot of focus is put on the girls, obviously, because she's the one carrying the child. But what about the young boys? Any support? Any information coming their way? You need to unmute yourself, Waidera.
Yes, I'm saying I can barely hear you. I don't know. I keep on losing you on this end.
If you can speak on the issue of male engagement, who's talking to the boys really quickly as we wrap up?
Pardon, I can't hear you.
Okay. Unfortunately, the technical hitch with Waidera, we haven't been able to get a link with her. So let's have Esther answer that question. Who's talking to the boys?
Who is talking to the boys? I think I must say that, still the society with raising boys to man up. I'm sorry, I'm bringing this because it's all our fault. It's all our responsibility. We are raising boys to man up, not to cry. So because of the flawed masculinity and what it means to be boys, we really don't have those systems and structures to start, dismantling some of these stereotypes and some of these stereotypes we have when it comes to being a man and what a man looks like. But then, just to comment, there are organizations that are working with men and boys, men engage, men can. So there are organizations doing the work, but I think it's also time for all of us. Those that are raising boys, I'm calling up on you to start raising your boys differently for them to be vulnerable. All of us that are also raising girls, to also raise girls, to be also responsible, but at the same time to have honest conversations with both boys and girls. Just to ensure that as we also talk to girls and have programs on girls, then also there are programs that are also targeting boys.
Thank you so much, Esther and Waidera, for your time. Certainly a conversation that we can't let go.
Yeah.